close collaboration with MOPH, with Hamad Medical Corporation, and with our expertise on sports to create guidelines that have been mentioned throughout the country, throughout the region, on our website, and actually have been received very well on the international platform. To give you an idea, after we documented the guidelines, because it was unprecedented, nobody ever had to do that. After these guidelines were made by us, we got requests from IOC to implement that in their global strategy. So actually the teams have performed amazingly from a very uncertain position to not only protect our players and our staff, to not only reduce as much as muscle injuries as we could have expected, but to make sure that this is in collaboration with everybody involved, all the stakeholders, and that has gone in a message throughout the world, and especially the world of sports international.
There are many ways that healthcare practitioners deal with the COVID-19 practical challenges. Aspetar will work very closely with government and the government initiatives taken, the gradual lifting of the lockdown measures, and our senior management and the task force has worked very hard to implement measures to help healthcare providers, sports medicine providers on ground level to deal with the challenges of COVID-19. Equally, we have under the Aspetar Clinical Guidelines and Pathway Committee assembled a guideline development group chaired by Dr. Iman Ergen. He assembled 27 experts to produce a guideline on safe return to sport during the COVID-19 pandemic. And this guideline is aimed at healthcare practitioners in sport, elite sports medicine, and athletes to guide them to make evidence-based decisions on their treatment. Now, this guideline was recently finished and we will publish it on our website online, so it is available widely to all the main stakeholders here in Qatar. And it's important to take into account that this guideline is specifically for Qatar.
What we have seen is that the first league that restarted was the Bundesliga in Germany. Now, after 10 days of COVID rest, you could see 14 extra muscle injuries compared to the last time. And that's why prevention and preparation is so important. Now, whether it's COVID or pre-season rest, it remains the same. We see the similar injury incidences when you start a season already. So it's just been twice now. And the most important injuries are muscle injuries. And that's not strange if your muscle haven't been triggered the same way as the sport-specific requests are made. Meaning, if you didn't train your hamstrings for 3 months properly while you do football or football training, but you have to go individually, then it goes wrong. So the major challenge for our teams and for QSL was first to make sure that our training individually is tailored to the specific needs of a normal training. And that was a big challenge because we could not train together. The second challenge was to make sure that our staff, our medical staff, our technical staff, our players, and the people around the team are safe. Because it's not just the players being together in a dressing room or in a training ground, it's the whole environment that can affect everybody and spread very fast.
I like the word an ecosystem of services to athletes. And this is how we approach the fight against the pandemic as well. In partnership with many individuals and many teams. We have to work together with the coaching teams, we have to work together with the managing teams, we have to work together with epidemiologists, with virologists.
The major message is the message by the country. Very simple guidelines. Social distance, wash your hands, wear gloves, and wear masks. Now, in a general point of view, that works. When you extrapolate that to sports, it makes it a bit more complicated. And we have trained our nurses for swabbing. We have trained our doctors for guidelines. And my message would be, talk with your doctor, with your medical team of the club, because they have been trained to the most newest guidelines to make sure that we protect our staff, our players, and our beautiful competition.
يا لها